Hi, I'm Dr. Nandita Patwari, consultant pediatrician and neonatologist from Cloud9 Sarjapur Hospital, Bangalore. So the visual stimulation of the newborn can be started immediately after birth. The best ways to start is, first we can use flashcards which have black and white pattern. This helps to stimulate the visual stimulation of the newborn. We can also do some FaceTime because newborns can recognize or at least appreciate the features of the face. So some close FaceTime with the immediate caregivers at a distance of 8 to 12 centimeter can also be an excellent visual stimulation. We can do tummy time. When we do tummy time, the baby lies on its tummy and looks at the outside world, and this really helps the baby recognize things and look at various objects in the environment. This also acts as stimulation. If the baby is lying down on the crib, then we can attach a mobile on the upper side of the crib which has rotating colorful devices. This also helps in visual stimulation. And fifthly, we can put the baby in different environments, in different rooms amongst different people. This also helps the baby get exposed to different kind of environment and different kinds of visual stimulation. These are the ways in which we can stimulate the baby. Babies can be stimulated immediately after birth. So right after birth, the babies can be stimulated. Once they are born, they are able to recognize black and white patterns and they can perceive light. So they usually close their eyes when bright lights are shown on them and open their eyes when the lights are a little dim. We can give them stimulation in the form of black and white cards, so that is one way of stimulating. However, colored vision develops at around only 2 to 3 months, initially red, then progressively green and blue. By 3 to 4 months, the entire range of vision for color develops, and that is how we can stimulate the baby. Immediately after birth, babies are only able to perceive black and white colors. It's only by 2 to 3 months that they start perceiving different colors. Usually the first color that they are able to see is red, then progressively green and blue, and then slowly the entire spectrum. By 3 to 4 months, they are able to appreciate almost all the colors. Newborns can see only up to a distance of around 8 to 12 centimeter and not a lot of vision peripherally. So initially they'll only be able to see at around 30 degrees of angle in front of their eyes. As the age increases, the peripheral vision or the extent of the vision increases. So they start seeing almost 180 degrees by the age of 3 to 4 months. But the distance is only 8 to 12 centimeter. As they grow older and older, the depth of vision increases.